One of the questions I got is, how is a second lumbar fusion done? And to answer that, it totally depends on how your first one was done. You know, is it a revision of one fusion that failed? Or is it you've had a fusion and now you need another disc fused? Because in that case, that surgery, I might want to place an artificial disc above or below a fusion. If it's a failed fusion, I might be able to reverse that fusion and change it to an artificial disc. So yesterday, I reversed a man's first surgery, which was a fusion. And that fusion had not healed. He had a non-union in the lumbar spine at the bottom disc L5S1. So I removed that fusion and cleared his nerves and placed an artificial disc, which now has restored motion. And today, this morning when I saw him at 6:30 in the morning, his leg pain is gone and his back pain is better. So that's a true success story, so we can approach these things differently.